So this video is going to demonstrate the technique of doing a Z skin plasty. And the purpose of doing a Z skin plasty is to lengthen the skin in one plane. So when designing this particular skin plasty, there are a few particular rules that you have to adhere to make sure that the flap comes together appropriately. So what we're going to be doing, there's going to be three incisions that are made, and we're going to create two triangular flaps of tissue that are going to be transposed. And when we do that, it's going to lengthen the skin accordingly. So you can see I did one here previously, and we're going to do a second Z-plasty right here so that you can see how this will come together. So in order to perform this procedure, the first thing you have to do is figure out what plane or what direction do you want to lengthen the skin. So in this particular situation, I'm going to lengthen the skin in the direction of this skin marker. So wherever that horizontal cut is made is going to be the direction of which you're going to be elongating the skin. So that'll be our first cut right here. We can see that nice bold purple line. So the two major rules that you have to adhere to in performing this procedure is to make sure that number one, all three cuts of skin are equidistant, or else the triangular flaps will not lay down nicely and close nicely. And then number two is we want to make sure that the two arms that are coming off this primary arm are approximately 60-degree angulated so that we can maximize the length of the skin plasty, and it will lengthen by approximately 75%. So the second arm coming off this primary arm is again going to be about 60 degrees off of this main arm, and it's very important to make sure that this line right here, this second line I drew, is equidistant to this line so that it comes together appropriately. And our second arm coming off that primary line is going to again be about 60 degrees off the main arm, angulated about, once again, 60 degrees from that primary arm. So it's very important that from here to here is the same as from here to here, which is the same as here to here. So let's make our skin cuts and see how this comes together. So I'm going to start out first with our horizontal incision along the axis at which we are going to be lengthening the skin. So once you complete that, the second one we're going to make off the primary incision, once again at about a 60-degree angle off the primary line. And then the third cut is once again going to be the same distance but 60 degrees in the other direction so that we can create two triangular flaps. Once you make your skin incisions, we are going to then complete these incisions and raise these triangular flaps by undermining the subcutaneous tissue by elevating our flap. So we have one triangle piece elevated. We'll complete the incision on the opposing side and once again create a full thickness triangular flap that's going to be transposed. Okay. Once we've created those two triangular flaps, then we should be able to transpose these two flaps so that the skin will then shorten in this plane, but lengthen in this plane, which is again where our scar is located and how we want to lengthen that tissue. So how I close the apex of these incisions is with a modified Allgauer Donati stitch. And what that's going to do is that is going to minimize trauma and maintain vascularity to the apex, which is going to be at the highest risk of necrosis. So let's suture this. It'll come together and we'll see how this flap transposes. So I'm going to enter my incision over here. And what I'm trying to do when we close this is I'm trying to pull this triangular flap over to this apex over here. So I'm going to do that modified Allgauer technique where I come through just the dermal tissue, trying to avoid penetrating through the epidermal tissue. Just like that. We're going to reload our needle, pulling through. And then again, I'm trying to pull that flap over here. So we're going to be exiting the skin over here. And when we close this, what we should see is that this triangular flap is going to be transposed and pulled in this direction. So let's go ahead and close this and see what happens here. So as we tighten this down, we should see that this piece of triangular flap is getting pulled in this direction as it lengthens the skin in the primary direction that we are trying to achieve. So let's go ahead and close this, and then we're going to lock down that other triangle, and then we'll be able to visualize the completion of that Z-plasty. So I'm going to go ahead and cut the excess suture on both sides, And we're gonna do the same type of closure, that Allgauer stitch, with the other triangular piece that we've created. So on this side, again, we're gonna enter right here. We're gonna come through just the dermal tissue on the other apex that's created within the other triangle. Again, the Donati, modified Allgauer Donati stitch. And then we're gonna come through and finish our stitch on this other triangular flap. So once we close down this flap, or close down this stitch, I should say, the other flap of skin you're gonna see is going to close really nicely. Again, preserving blood supply to that apex, and that should help to minimize the risk of necrosis of the apex of that flap. We'll go ahead and cut this suture. And then once you've got the triangular pieces of skin transposed and we've gotten the length within the axis that we were trying to achieve length, then we're just gonna fill in the remainder of our sutures with simple interrupted sutures or your suture technique of choice. And I'll just, for time purposes, close one on each side so it lies nice and flat, and then we'll be able to appreciate the final closure. So there's one. And we'll do the second one on the opposing side. And again, in a real case, what we would do is we would close down the remainder of the opening skin with simple interrupted, or again, suture technique of choice. Okay, so what we'll do is we'll cut our excess and we'll take a look at our closure. And what we can see here is that we have now created a Z-shaped closure. The skin has lengthened in this plane, and we should be able to preserve blood supply at these two apex of these triangles, which is again going to be the most vulnerable area within this skin plasty. So that will complete the Z-plasty, which again lengthened the skin in this particular direction. If you have any questions, please comment below. Thank you.